health officer's report.
Need to go through that?
Yeah, I do have a couple of questions. I think maybe I asked you this earlier, but then forgot to follow up. A couple of the things in the environmental report. There's just a couple of data points that I was wondering if they're correct or not. The source water program D. So that's page 8 where it says 149 groundwater sampling. Do you know if that is?
Yeah, that's the 149 is
Do
for.
you mind coming up and so everybody can hear you?
So every year we sample out at Jude Creek subdivision for road salt contamination. And so there's 140 plus homes out there. And so that's where that number comes from.
Oh, so basically every July or so, that's when you go and do the sampling. So that's why the number is spiking.
Yeah, usually the second week in July, we go out and sample.
All right. And then in the vector program, page 8D, under the vector program, just those numbers are the same, but is it just because this is really kind of the first 131 for the month of July, 131 for the year to date?
Right.
Is that just because the
These 131 and 131,
This is reporting for July.
July, and then
Yeah. Yeah, I did not submit any results for testing at the State Department of Health until the 1st of July.
Oh, okay, great. And under complaints and investigations, I guess I'm curious what other refers to. Like complaints and investigations regarding, they have regarding garbage, sewage, water, burning.
right. Yeah, a lot of those are gonna be, especially with the economy the way it is, we're seeing a lot more people living in tents and campers and RVs. And so a lot of those fall under that category. Or a follow-up inspection where we would go back out to see if anyone, we get squatters in homes and we're starting to lock the homes up now. And then we just go back and check to see if they broke through the locks.
Okay, so if there's an abandoned home in the community and you find out that somebody's squatting in there, do you go out? Is the person removed? Do you?
It's,
Oh, yeah, they're rude.
it's so there's no running water or
Yeah.
sewer usually, right? So it's an environmental risk. So there's a whole process we have to follow. We file with the court, we get an order
Okay,
that, essentially condemns the property, says you can't access it. And then we have the police assist us with removing the individuals.
okay. And then you will put a lock on the property to keep people from coming in?
We're
Yeah,
starting that.
Recently, we've started locking them because we're having difficulty getting the help we need from the law enforcement to remove. And so we're working on some language changes in our orders and then part of it is when they have the people leave the home and we don't have a way to secure it, they don't want to just keep going back there every day running people out. So we are locking up the homes, just the doors with padlocks. And then, but we're gonna see how that works out.
Okay, okay. Thank you.
Anything else?
Well, Brett, while you're up there, do you want to tell us anything about West Nile?
It's not great. As of this past week, we now have an elevated infection rate, which it would now be reasonable to assume that we could expect human cases in the next couple of weeks. The good news is that the total numbers of mosquitoes are down. I'm going to attribute some of that, a decent amount of that, to our larviciding program that we've done this year. So our overall numbers are down, but the infectivity rate of those mosquitoes is up. We're running about 2.5 weeks ahead of schedule, as opposed to last year. Every year, it seems like we reach our threshold a little earlier and earlier, but all year we've been consistently about 2 weeks ahead of schedule. So at this point, we've already had pretty intense efforts, but we're intensifying our efforts, being diligent about our sample submissions and how much we're running in-house to make sure that we have accurate and up-to-date data and responding to it as quickly as possible.
So you found some mosquitoes in the county with West Nile?
A lot of them, yeah. We're up to 38, 39, 40 as of today, positive pools of mosquitoes.
Oh, 40 pools. I was
Yeah.
gonna ask where you're seeing the most.
We're all over the place.
Oh.
Clay Township, German Township, down in Walkerton, south side of South Bend, west side of South Bend. It's pretty much all over the place right now. I wouldn't say that there's anywhere in particular that has not. I think right now, New Carlisle is our only municipality who hasn't come back positive in some way, shape, or form.
Any other questions for Dr. McLeary or Brett? Health Officer's report? Any final things you'd like to point out? for the board?
I would just like to say that we've kicked off our HFI funding campaign. Letters of intent will be due the first part of September, and we've had a lot of interest. We've tried to get a lot of advertisement out, let people know that the grants are available, and want to partner with those in our community that are able to help us keep healthy and get healthier.
Thank you. I believe we need a vote to approve the health officer's report as presented.
I will move to approve the health officer's report.
Second.
Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. All right, moving on to new business. First item, 2433, discussion and vote appointment of Michael A. Harding to a Board of Health Committee. I believe we have a vacancy on the Personnel Committee. Would love your service there, but I'll entertain nominations for Mike, or if you have any comments you want to make.
None.
I get a motion to assign Michael to the Personnel Committee.
I'll make a motion to assign Michael Harding to the Personnel Committee.
Second.
Any further discussion? All right, hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. All right, motion carries. Congratulations. Next item on the agenda, 2434, discussion and vote, apply, receive memorandum of understanding between Real Services and St. Joe County Health Department.
Hello, guys. Jody Parrott's Director of Nursing on the ninth floor. This is a contract that basically Real Services wanted. They received a grant and wanted to partner with us so that we could go out to their sites to provide vaccines for the older population and for people with disabilities. So hopefully through these efforts, we'll be able to serve some of these populations on their sites.
Any questions for Jody?
So this period, it says June, did this already start or?
We have not done anything with them, but it's just when it was stated.
Okay.
So,
And were you already doing this? This isn't a new thing.
this is right,
The
correct.
contract is it's just a legal paperwork.
Correct.
Okay.
We're seeing more and more community partners that we do events with requiring that we have a memorandum of understanding now. It's sort of a new wave this year.
And do you just, is it that you provide the vaccines and then get reimbursed from Real Services?
Not
Or-
necessarily the vaccines, but like our, they're trying to help us with supplies, equipment, gas, those kind of things. So that money goes back, and I can, talk, well, we can have Amy come up here to verify if I get it incorrect, but it's supposed, that money's supposed to go back in to, just the pool that we
Okay.
usually have to provide other services.
Okay.
Yeah.
Any further comments or questions? Hearing none, I'll entertain a motion.
I make a motion to approve item 2434.
I have a motion. Do we have a second?
Second?
Motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. Next item on the agenda, 2435, discussion and vote to receive a donation of $50,000 from Barb and John Fair Foundation to the School Health Community Partnership Program.
Hello, thank you for allowing me to speak to you tonight. I'm Ashley Hellman, nurse and the school liaison for St. Joe County. I'm here to talk to you tonight about a proposed donation from one of our generous community members. The donor, the Barb and John Fair Foundation, is proposing a $50,000 donation to be split evenly among schools in St. Joe County. We'd like your support in receiving this donation. We spoke together in June about the needs of school nurses for supplies and to help get kids out of the nurse's office and back into the classroom learning. And we, at that time, the program was approved. We knew that people in the community wanted to help, but there was no system in place to do so. And so the team worked really hard to get this program up to speed, and it went live just in time for back to school. So we did a short interview about the program with a radio station in the area. And John Fair heard that interview and was moved to help. He contacted us and said that he would like to support all schools within our county and with a donation of $500 per school. And thank you to Ellen for finding the school we were missing on our list, but we are back up to 100 schools in St. Joe County. And so that's where the $50,000 number comes from. This is a huge opportunity for local schools. The monies would go directly to them to purchase items from the school health community partnership program. The money wouldn't go directly to them, but it would be used directly for that. After the funds would be approved, appropriated and available, the schools would request specific items that their school most needs from the list of items that we spoke about and approved in June. And this is a great opportunity for us to partner with our schools, to partner with members of our community, and I'm happy to answer any questions you may have.
Can you run down the list of items again real quick for some of the
Sure.
board members that maybe weren't here?
Yes, definitely. So the items that we have approved for the program are hygiene items, things like soap, toothpaste and deodorant, clothing, underwear, pants and socks, menstrual products, and then specifics, food items for diabetic support for students to regulate their blood sugar.
Didn't we have like the AEDs also?
That is not a part of this program. So this is completely a donation program that we're using that Amazon wish list for. And so this is coming straight from,
That's from a different.
correct. That is from the school health fund.
And then did you say you did add aloe?
Yes.
Yes, we did. Oh, was it you who's,
Yeah.
Olive?
Sorry about that.
I was
Sorry.
trying to chat up here ahead of time.
Okay.
Before the.
Yes,
So
we're
we
adding
are-
Olive onto that list, yeah.
And then how do do you anticipate that every school will actually utilize that $500?
We really hope so. So we have some ideas about how we're going to get the information out to schools. One thing that we found when we're visiting schools, so, we went out last spring and talked with people that are working in the schools to find out, their need level. And what we found is that need knows no zip code. So even though you may have a school where you have most kids with their needs met, there's still always going to be kids who don't have what they need to be successful and to be in the classroom. And so I did not visit a single school where they said, we have everything and we're good to go. So we are going to encourage schools to use this program. And then if we're finding schools that aren't using it, we're going to be reaching out to them personally, individually, just to make sure that they know it's available and that they have the opportunity to utilize those funds.
And if they're not utilized in full, what will go to, what will you do with the remaining funds, like disperse to the other schools or?
So I believe that the $500 is to each school. So we would have to make a decision after the year as to what would be done with those. They would either continue to attempt to contact that school or be dispersed to the other schools. And this program is to help get kids, into the classroom. And that's something that the fairs are very passionate about. And so, there is a possibility for this support to continue if we can demonstrate that the program that we're doing is reducing absenteeism and increasing instructional time.
And how are you notifying the schools, you said? You're notifying them all?
Yeah, so we're gonna use multiple methods. We have email lists, we have a letter list because we want to make sure everybody's receiving something. We are going to be using social media. We are going to be using regular media. The fairs are happy to participate in that as well to help let people know that the program is available. Their concern too is that everybody knows that it's there and that the resource is ready to be used.
I was just gonna say, I'm roughly $500 a school. I mean, it would seem like that would be plenty to put together for any school, like a basic kit with kind of a representative sample of all of these things, that, and then I'm assuming though you're still gonna continue to get donations that are gonna
Yes.
be available for schools where they have more need.
Above and beyond, yes.
Yeah.
So we've seen already a really great response from the community. We're receiving donations daily. And those will still be available for schools to request, just like we talked about in June. And the reason that, we're going to have schools ask for what they want specifically for their schools with that $500 is because, of course, every school is different in their needs, but we're hoping that, yeah, that can make a big difference and make at least a dent in their list.
Mhm.
Great. Any other questions or comments? I presume legally we're all square?
Make a motion to approve item 2435.
I'll second.
There's a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. And I guess I'll say it on behalf of the board, to Barb and John Fair, thank you very much for their generosity and we hope to make them proud with what we do with these funds and we look forward to their continued support.
Second.
Next item on the agenda, grant requests. We have none this month. Old business, we have none. So the next item is public comment. If you would like to speak, please sign up. Before I read the spiel, Jenny, do we have anybody signed up?
Yes.
Okay, great. At our regular meetings, the public is invited to address the board for 3 minutes regarding items posted or not posted on the agenda. Individuals may only speak once during this section of the agenda. Speakers shall properly identify themselves by stating their name and address for the record. Personnel issues are not to be addressed during open sessions of the Board of Health. The board president may interrupt, warn, or terminate a person's statement if the statement becomes personally directed, abusive, obscene, or inflammatory. With that, Jenny, who do we have first on the list? Welcome.
Good afternoon, Cynthia Hickman Davis. My address is on the sheet. I echo President Lynn. Congratulations, Mr. Harding, on your appointment to the Board of Health. Welcome. I have a short comment on one of your Health First Indiana grantees. I had the opportunity to volunteer at the Pop-Up Pregnancy and Family Village Saturday at the Kroc Center. The Pop-Up Villages is one of the grantees created by the X Center at Notre Dame. Dr. Lindemann was there answering medical questions. There were 28 groups offering different services for mental health screenings and appointments for all ages, breastfeeding support, access to medical and life insurance. Goodwill was there, the Babe Store was there, WIC was there, the Department of Health was there. There were lots of activities for kids of all ages. There was food for people to get. I was not aware of the Shaw Center for Children and Families before volunteering Saturday, so I appreciated learning about that. One of the other volunteers signed up for mental health counselor training. I was impressed with the scope of the actual services offered and reminded that the United States has the worst among wealthy countries for maternal infant mortality. And of the United States, Indiana is among the very worst. And in Indiana, South Bend has one of the zip codes that is among the very worst for maternal fetal health. Decreasing infant and maternal mortality takes more than just education of pregnant women. It takes access to services supporting the health and wellness of the entire family. There will be another pop-up village in September, and then the Notre Dame researchers will fine-tune what they've learned. Their plan is to start rolling out monthly pop-up villages starting in March, I think. Offering consistency with this program will be just as important as access to the coordinated services. So it was great having all these services available under one roof, and people could go get insurance or go find a doctor appointment or go grab a sandwich or have their kids do drumming. So overall, I think that this grantee has a good start. Thank you.
Great, thank you very much. With that in mind, do you know offhand the date of the September pop-up?
28.
28. Okay, thank you. Anybody else like to speak? That's it. All right, thank you. Next item on the agenda is the time and place of our next regular meeting. It's scheduled for September 18th at 4:30 here in the council chambers. Does that work for everybody?
Are we trying to change that date?
I heard rumor of that, but I'm not bringing it up.
I'll bring it up later.
All right.
Oh.
And with that, I'll adjourn the meeting, or meeting is adjourned.
Thank you.
I think so. I was at the feedback myself.